Hello friends, today we will discuss our medical discussion episode number 38. Today our topic is memory loss. So my first question is to you that in our day-to-day life, we used to forget so many common things. Sir, when we will think that this memory loss is because of serious diseases?
So obviously memory loss, it is a very common symptom because the lifespan of the population of the world is increasing, and so the prevalence of memory loss, especially in the elderly population, is obviously increasing. So we ourselves encounter a lot of people who forget a lot of things in day-to-day life, and we ourselves even forget so many common things, but not all of them indicate a serious disease. We see that mainly in the teenagers or in the 20 or 30 years population, the ability to remember things, ability to learn new things, it is at its height. But as the age increases, this ability progressively decreases. So this is a normal phenomenon. However, there are certain symptoms which may indicate the onset of certain serious diseases. First of all, we should see whether a person who is near to us or whether a patient who comes to our OPD, he is facing difficulty in keeping track of his appointments, or if he has already made some plan and suddenly he has forgotten everything about the plan, or if he repeatedly asks the same questions, then it may indicate antegrade memory impairment. That is, it indicates that there is difficulty in learning or retrieving the already learned information. So this is known as antegrade memory impairment. Then if a person is unable to remember the already past events, the already experienced past events or his personal information, this is known as retrograde memory impairment. So it usually indicates that he is facing difficulty in retrieving the previously learned activities or previously learned experiences. Then if a person suppose walks into a room and suddenly he forgets why he has gone to that room, so it usually indicates difficulty in maintaining attention, or there is some problem in his concentrating ability. Again, some people face some difficulty in remembering the name of the common people he encounters in day-to-day life, or he failed to remember the name of his friends or the other celebrities that he used to remember before, or he suddenly forget the path to a place which he knows already. So this indicates that he has some difficulty in the language functions. Or if a person suddenly becomes lost in an area, he knows that area but suddenly he faces difficulty in finding the way to his home or finding the way to a place which he knows already. So this usually indicates physiospatial disturbance or disorientation. Or if a person has some problems in judgment or ability to follow the orders, suppose I have asked a patient or any person to do a certain thing. Suppose I ask the person to close the lid or ask the person to draw a circle. If he cannot execute that function or if he cannot follow that order, it usually indicates difficulty or disturbance in his executive function. Or if a person give up his normal day-to-day activities, this is a serious problem I am talking about. If a person give up his day-to-day activities, suppose if a person has the habit of reading newspaper when he gets up in the morning, or if a person used to go for morning walk, if he or she abandons such activities, or he makes regular mistakes in the common activities, suppose he makes mistake in wearing the shirt, or if he makes mistake while eating, or he forgets how to eat, or he needs assistance in those type of activities, then this usually indicates dementia. This is a serious problem because there are lot number of neurodegenerative diseases can lead a person to dementia. So these are the basic symptoms, or these are the most common symptoms which we should remember, and this type of symptoms usually indicates the onset of some of the various serious problems that may affect the memory in future.
So my next question is to you, that what are the various causes of memory loss?
So before discussing the various causes of memory loss, we must know what are the different types of memories and what are the diseases or what are the causes that usually affect this type of memories. First of all, there is the episodic memory. It is the memory which help to learn or which help to retrieve the already learned or experienced episodes of life. So some of the diseases or disorders can affect this memory, which is known as episodic memory. The most common disease is the Alzheimer's disease. So it is a kind of neurodegenerative disease which usually occurs in the late age, or sometimes it can be genetic. So Alzheimer's disease affects this episodic memory. If a person has recurrent stroke or a person takes alcohol for a long duration, then also the episodic memory gets affected. Then comes the semantic memory. Normally the semantic memory is that memory which helps to remember the normal general knowledge about the world. We remember a lot of knowledge like the Prime Minister of India, President of America, the different general knowledge which we, almost all the common people knows. So this is known as semantic memory, and some of the diseases like Alzheimer's or stroke or brain tumors or even other neurodegenerative diseases like Huntington's disease or Parkinsonism affect these memories. So in short, I want to tell about Parkinson's disease. Parkinson's disease is that disease where a hormone called dopamine, it gets reduced in the brain, and because of that the person can have tremors, the person can have rigidity. So in short, this is called Parkinson's disease. So in Parkinson's disease also the semantic memory gets affected. Then comes the procedural memory. It is the memory which helps to do a certain procedure like riding a bicycle, driving a car. That is the normal procedures that we do in our day-to-day life. This procedural memory helps us to do it. Now, this commonly gets affected in Parkinson's disease as well as Huntington's disease. It is a type of neurodegenerative disease where there is progressive death of the neurons of our brain. Then comes the working memory. Working memory is that memory which helps to do certain problems or helps to solve certain problems in our day-to-day life. Like we do maths, we can solve a math problem. It is because of this working memory that we can solve a certain problem. It also helps in the judgmental decisions or solving different type of puzzles. So Parkinson's and Alzheimer's disease affects this working memory also. Moreover, there are certain medical conditions like thyroid disease, anemia, recurrent stroke, different toxins, even alcohol, or depression or stress and anxiety. These are very common causes that affects our memory in the long term. Moreover, if a person has seizure disorders, that is if a person has recurrent seizures and if it is untreated or uncontrolled or unmanaged, then also a person can have memory problems in the future. With the help of the time of onset also we can diagnose certain causes, like if a person has memory loss within seconds to minutes, then we can think of stroke or seizure disorder. If a person has memory loss over days to months, then we can think of certain toxins or certain metabolic causes like diabetes, hypertension or thyroid disorders or neoplastic diseases like cancers. Then if a person has memory loss over months to years, then certain degenerative disease can be thought of like Huntington's disease, Parkinson's, Alzheimer's. These are the various diseases which causes memory loss over months to years.
Thank you, sir. My next question is to you, that what are the things that can we do to prevent our memory loss in future?
So obviously this is a very important question because we have already discussed the various medical problems which can be treated at a very early stage, and this helps to prevent memory loss in the future. Our brain, our neurons are like the muscles, like if we do exercise, our muscles get refreshed and rejuvenated. Similarly, if we exercise our brain, then also our neurons get rejuvenated. The main thing is that we should involve in intellectual activities, do social activities, reading a book, solving problems. It helps to continuously exercise our neurons, and the death of the neurons slows down in the in the older ages. So this is a very common technique by which we can prevent memory loss in the future. We have also discussed the various neurodegenerative processes. These neurodegenerative processes can be diagnosed at a very early stage if we consult the doctor at a very early stage when we have mild cognitive impairment. Moreover, following certain lifestyle changes like having a good sleep of 6 to 8 hours daily, eating a diet rich in fruits and vegetables, decreasing the animal protein intake, saturated fat intake, moreover exercising daily at least 30 minutes a day and 5 days a week help to rejuvenate our neurons and prevent memory loss in the future. Stress and depression, these are major culprits which causes a lot of problem in our memories. So relaxing our brain and decreasing the stress, decreasing the preventing depression also help to prevent memory loss in the long run.
Thank you, sir, for the wonderful medical discussion. We have learned so many things. Hope it will help all of us. So at last, what you would like to request to the audience?
So memory loss is a very common problem. Most of the time it usually indicates a normal process, but we should be very careful. We have already discussed the symptoms which may indicate a serious problem. Moreover, we should be very careful about the various medical problems, very common medical problems like diabetes, hypertension, thyroid disorders. So controlling these medical problems also help to prevent memory loss in the future. I hope this video is very helpful to you all. Please like the video, share the video and subscribe our channel. Thank you all.